So basically, we talked about peripheral resistance. Now we will talk about elasticity of the large arteries. Now it's work to elasticity of large arteries. So basically, whatever large arteries are present, we studied about smooth muscle, okay, and the three layers of the arteries and veins. So here, large arteries which have elasticity, they also stretch their walls, okay. Then basically the ratio of the BP maintain. Next, viscosity of blood is also very important. Viscosity means thickness, means whatever red blood cells, WBC, plasma, protein, albumin. This is also very important. They have the normal range. If they are in lesser range, the viscosity is less. If they are more number, the viscosity is more. Viscosity means liquidity part. The blood is normal viscous, then only if you send in forcefully, contraction will happen and the blood will go easily. If there is more viscous, the heart need more pressure. So there is a large amount of red blood cells, the large amount of albumin, proteins. What will happen? Blood become more viscous. Okay, having too many red blood cells is rare, but does occur in the disorder called polycythemia vera. Polycythemia vera is a condition in which too much uh, WBC are there. Okay, too much RBC are there. Okay, who are have heavy smokers in the who in whole, which person the large number of RBC is seen smokers. This will increase blood viscosity and blood pressure. So what will happen? Viscosity, what the liquidity part, okay, and the blood pressure increases. And what will happen if the decreased number of red blood cells will happen? It will seen in anemia, severe anemia, albumin, as well as occurring liver disease or kidney disease. Will decrease blood viscosity and blood pressure. In this situation, other mechanisms such as vasoconstriction will maintain blood pressure as close to normal as possible. Yesterday, in the clinic, I got one patient. He is telling that I have some dizziness. So when I checked her BP, her BP is in low range, hypotension, 80 by 50 or 55 something. So why? Because of anemia. Because of anemia, her BP is always in low side because there are not large number of red blood cells is there. So low number of red blood cells make blood thick. Okay, make blood thick. So what will happen? The blood cannot reach to the all parts of the body, and RBC are necessary for oxygen transportation. We have HB, everything is there. Okay, so basically, so that's the reason the bed is not reaching that area. So the patient getting giddiness. So we need more red blood cells. So I gave her the anemia protocol, and I asked her any problems during menstruation. She told no problem, regular is there. So I think because of low diet or abnormal diet, she is getting anemia. So I gave in electro-homeopathy medicine and advice to take good diet. Okay, good diet is very important. We have one subject also, food and hygienic or nutrition. So in that we will talk about everything related to the nutrition and diet. Okay, how the diet is important, how we maintain our new diet is very important. We will discuss in that chapter. So basically here next is loss of blood. So here all those things are helpful to maintain blood pressure. This is the systemic, matlab, body other parts will maintain the blood pressure. Try to maintain. If the heart is all the all the body's head, but at how to maintain the blood pressure, we need support from other organs also. Next is loss of blood. What will happen when the loss of blood happens during pregnancy or any injury to the brain, to any part of the body? A small loss of blood, as when you're donating a pint of blood, will cause temporary drop in blood pressure, followed by rapid compensation in the form of more rapid heart rate and greater vasoconstriction. After a severe hemorrhage, however, this compensatory mechanism may not be sufficient to maintain normal blood pressure. Blood flow to the brain, although a person may survive loss of 50% of the body's total blood, the possibility of brain damage increases as more blood is lost and not rapidly replaced. So, what will happen? Lost blood. So, we have likewise any problems occur in the family. So what will happen? We have supporters. We have son, we have a brother, we have sisters. What will happen? Whenever a problem occurs, they will reach. If the problem is something resolved by the family members, it will be resolved. But if the problem is big, what will happen? We need more support. Like the body also, whenever a huge amount of blood loss occurs, whatever compensatory helping relatives of the body will come to help the loss of blood. But if the blood loss is more than 50%, what will happen? We need more blood from outside. We need blood transfusion, because if we doesn't give the blood to the body, what will happen? The brain can damage, because brain is not getting oxygen properly, glucose properly. Continuously it will need. Okay. Next we have hormones. Hormones have also role for maintaining blood pressure. Several hormones have effects on the blood pressure. The adrenal gland medulla secretes norepinephrine and epinephrine in stress situations. In that condition, the blood pressure increases. Adrenal glands releases epinephrine and non-epinephrine. What will do? They will do vasoconstriction, which raises blood pressure. Epinephrine also causes vasoconstriction and increases heart rate. Non-epinephrine will do vasoconstriction, then blood pressure increases. Epinephrine, vasoconstriction, heart rate increases, and force of contraction, both of which increase blood pressure. So they will help to maintain blood pressure. Epinephrine and non-epinephrine, which is released by adrenal gland, which is present posterior to the kidney region. Okay. Next we have ADH. These all those things we studied in endocrine chapter. Here already coming for BP maintenance. Next we have antidiuretic hormone, which is secreted by posterior pituitary gland. When the water content of the body decreases, ADH increases. The absorption of water by the kidneys to prevent further loss of water in urine and further decrease in blood pressure. What will happen? ADH is the antidiuretic hormone. So it will protect all the important things which is going to the urine. It will protect to reabsorb it, like sodium, potassium, glucose, everything. Okay. So it will also help to maintain blood pressure. ADH and aldosterone. Aldosterone also is a hormone which is secreted by adrenal gland in cortex region. When blood pressure decreases, secretion of aldosterone stimulates the reabsorption of sodium ions by the kidney. So what does aldosterone do? It will reabsorb sodium. Okay. Water flows sodium back to the blood, which maintains blood pressure to any further drop in the blood pressure. So here also non-epinephrine, epinephrine, and ADH, aldosterone. Next we have atrial nitro nitriuretic peptide, ANP, also we discussed. Okay, this is also a hormone which is secreted by atria of the heart, upper part of the heart, to maintain functions in opposition to aldosterone. ANP increases the secretion of sodium ions and water by the kidney, which decreases blood volume and lowers blood pressure. So what is the function of ANP? It is opposite to the aldosterone. Okay, aldosterone absorb the sodium, but here ANP will release the sodium from the body. Okay, this is opposite action to decrease the blood pressure. So whenever we need to lower the blood pressure, ANP is activated. Whenever we need higher blood pressure, here number of hormones, norepinephrine, epinephrine, ADH, aldosterone, all will activate it. Next, distribution of blood flow. How the blood flow distributed. So here is the everything is given. This is the adrenal gland, which is kidney. Okay, how the BP increases. Here norepinephrine, vasoconstriction, epinephrine, vasoconstriction, which will increase heart rate and force of contraction, then BP raise. Next we have kidney. Kidney have aldosterone. Kidney pituitary gland will release ADH. ADH will act on kidney. PNP. ANP, which is present in the atria, will release ANP and it will increase the sodium excretion. So BP decreases. ADH will increase sodium absorption, reabsorption. Then BP increases. And that's how it happens. Now is distribution and blood flow. An individual blood volume remains relative constant within the normal range appropriate to the size of the person. Active tissues, however, require more blood, that is more oxygen. The do less active tissues, as active tissues and organs receive greater proportion of the blood flow. Less active organs must receive less, or blood pressure will decrease markedly. As mentioned previously, peripherally sphincters dilate in active tissue and constrict in less active tissues. The arterioles also constrict to reduce blood flow to the less active organs. So basically, the maintenance of distribution blood flow will happen, okay, from aorta to all parts of the body, which is very easy. You have to remember. But wherever the body need more blood, so what will happen? We studied that there is sphincters in the arteries. So the sphincters work more to get the concentration of blood towards them. If the construct contract means the blood flow to that region will happen more. Like our digestive system, kidney need more blood flow, our brain need more blood flow. So like that, this happen. Okay. So this is the distribution blood flow. We have regulation of blood flow. This is maintaining blood hypotension or BP with the help of whatever things are present in our body. But overall maintaining of blood pressure, how it happens with other things. Okay, this is we will talk in detail. We have intrinsic mechanism and nervous mechanism. Though both are helping each other to maintain blood regulation, BP regulation. Okay, so if any doubts, you can ask.